Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, differences between inflammatory breast carcinoma and also non-inflammatory breast carcinoma. So, breast carcinoma can be inflammatory or non-inflammatory. So, the differences between inflammatory and non-inflammatory breast carcinoma. So, first, inflammatory breast cancer. Inflammatory breast cancer, here dermal lymph vessel invasion is present. The dermal lymph vessel invasion is present in inflammatory breast cancer, whereas in non-inflammatory breast cancer, the dermal lymphatic lymph vessel invasion is absent in non-inflammatory breast cancer. Then inflammatory breast cancer is not sharply delineated. You cannot define the inflammatory breast cancer easily. It is better delineated. You can easily show or delineate or sharply define the non-inflammatory breast cancer. In inflammatory breast cancer, erythema and edema is seen in more than 33% of the skin is involved in erythema and edema in inflammatory breast cancer. Whereas in a non-inflammatory breast cancer, erythema is mainly confined to the lesion, whereas if you see the erythema is confined to the lesion, but the edema is extensive in non-inflammatory breast cancer. Inflammatory breast cancer will have lymph node involvement in more than 75% of the cases have lymph node involvement in inflammatory breast cancer. In inflammatory breast cancer, there is more than 75% of the lymph node involvement is seen. Whereas in non-inflammatory breast cancer, the lymph node involvement is only seen in more than 50%, or it is seen in approximately 50% of cases will have lymph node involvement inflammatory in non-inflammatory breast cancer. In non-inflammatory breast cancer, only 50% will have lymph node involvement. Then in inflammatory breast cancer, distant metastasis is around 25% in inflammatory breast cancer, whereas in non-inflammatory breast cancer, this distant metastasis is less common. Next, in inflammatory breast cancer, sometimes this distant metastasis may be the initial presentation, but such thing is not seen in non-inflammatory breast cancer.
thank you and thank you for watching.